Was the Director General of the World Health Organization. Now we'll listen to the Ghana Medical Association, Dr. Frank Serebo, talking about vaccination in our own country. So let's listen to him.
Have their actual numbers. Hopefully we'll put the numbers together. We've done that in the past. Now that we are having surge in the number of cases, you will find both the JRMA and the Ghana Medical Association putting these numbers together and then telling people how many of our people have been infected. It is to our own advantage. I am sure you are aware that we would always push for frontline health workers some form of allowance, isn't it? So we like the figures. We even like it more than the person asking, because it is good for us when we use those figures to justify why our work is a risky one and that somebody has to look at us. And indeed, it is a risky job. The 40% that we talked about is actually not sacrosanct. This is a rough estimation of the number of health workers who have actually been vaccinated. But we would, through these projects, probably we will come out with the actual numbers and the figures, but it is quite substantial. And I can say that it's higher than what exists within the general population.
Welcome back, viewers. This is a spotlight. We talk about vaccine and vaccine hesitancy. So we have Dr. Richard Salome, Dr. Alfred Kwesi-Mensah, and Dr. Chris Owu joining us on the call. Good afternoon, doctors. Can you hear me, sirs?
Good afternoon.
All right, so it's an honor to have you join us. We'll jump straight into the conversation. Dr. Richard Salome, if you can hear us, what are the numbers of COVID as at today?
Hello, can you hear me, please?
Yes, I can hear you. Can you hear us, sir?
Yes, I think I'm not getting you clearly. Let me just please check my connection well. If you can hear me, please.
Okay, Dr. Richard Salome, the question is, if you can hear us, what are the numbers of COVID as we speak now? What are the statistics saying?
Okay, great. I can hear you now. I think it's better now.
Right.
So, greetings to your listeners. And as of today, if you check the Ghana Health Service dashboard, which is the source of information for COVID, the situation, we are currently standing at about 1,311 active cases, with about 243 or so new cases coming on board. So that is the active cases that are as of today.
Right. So out of the active cases, how many mortalities or how many deaths are we seeing? If we're getting 243 new cases, how many deaths are we recording with the new numbers?
I would have to verify the details of that statistics, but in total we've had about 1,448 deaths from the start of COVID up to now. Right. But I would have to check. With the new cases, I know we have very relatively, compared to when there were no vaccinations and then at the early part of the disease in the country where we were now getting to terms of how to manage the cases, the deaths have gone down, the severe and then the critical cases have gone down. I believe Dr. Owu might even be better placed to speak to that than I am. Thanks.
So 16 million vaccinations were told. Is it enough? 16.2 million doses of COVID vaccines already administered in Ghana. Is this enough?
No, we have made some good progress, but what we are referring to as 16 million are individual doses of vaccines and not the fully vaccinated individuals. We need to clarify the difference between the two. The fact is that we have had over 16 million individual doses of vaccines. However, if you check only about 32.7% of the population that qualified to be vaccinated.
32.7.
Yes.
Right.
Yes, if you verify from the dashboard, only about 32.7% of the population that qualifies to be vaccinated have actually been vaccinated, fully vaccinated. That have had one dose, at least one dose. But if you look at those who have actually been fully vaccinated, have taken at least 2 doses and more, these people are just about 22.5%.
So that reduces, so the 32.7, just for the purposes of clarifying the fact, 32.7 remains
yes,
at least one dose taking, and 20.
They've had at least one dose.
Yes, and 23.
Yes, about 22.5%.
22.5 are
yes,
fully
they have
vaccinated.
Taken the full vaccination.
Right. So that is one out of every 3 Ghanaian has at least taken one dose, and 1 out of every 5 Ghanaian at least have gotten a complete vaccination.
Yes.
Right.
But this, as we are talking about, is low because the target of the vaccination is to vaccinate about 22.9 million individual Ghanaians who should have been fully vaccinated. So if you look at this, we are really behind schedule, and we need a lot more people to get vaccinated. Whilst we still emphasize the other protocols, the vaccination provides a second layer to help us, especially in prevention of the severe forms of COVID, which we are much worried about.
Right, Dr. Richard, since you're the General Secretary of the Medical Association, before we move on, can you confirm for us, are the health workers refusing to take vaccinations?
I'm the Assistant General Secretary of the Ghana Medical Association, so that my General Secretary doesn't begrudge me.
Right.
One, I want us to use the right language so that we do not paint the wrong picture to the public. The first thing is that the president of the Ghana Medical Association spoke clearly, and he did not say that health workers refused to take the vaccine. And then we just need clarity on this matter. Let's not focus too much on the numbers, but what we are worried about is the fact that some health workers have concerns about taking the vaccine and are not taking the vaccine as we expected to. And these are serious implications for the public. And that is why we spoke about those issues that we spoke about. So it's not that health workers are going out there refusing to take the vaccines. Some have concerns, just like pertains in the general public, but these are the concerns we need to address so that they become role models for the public.
Right, yes. Let's go to Dr. Chris Owu. Doctor, please, if you can hear us, it's an honor to have you. Why is the vaccine not mandatory for health workers?
Good evening, and then thank you for having us, and good evening to your listeners and to your viewers. Okay, so let me start off first of all by saying in making anything mandatory, any intervention mandatory, it entails quite significant activities, a good amount of it legal. I believe we're all in this country in December when even the president and the Ministry of Health started a discussion or the conversation about possibility of mandatory vaccination. And we are not ostriches. We can remember the reaction by sections of the population. As much as possible, it is always better when you can carry the people along in discussions and have people voluntarily basically agree to vaccinate than to ask to force people. Whenever you put mandatory or force people, you would have to also have ways of ensuring implementation, and logistics that had to do with that is quite significant and something that is deterrent. I think we've gone beyond that question in all certainty about whether we should force everybody to vaccinate. What the discussion rather would be, what risk do you pose to other people? What risk do you pose to yourself? What are the reasons why people are not vaccinated, including health workers? Let me also say that it is important to situate these statistics properly. Health workers are members of the population. They are from the same population we're talking about. And they have similar beliefs, similar belief systems, similar identities, religious and otherwise, similar to the population. And therefore, although we say that it would be very, very good if health workers see themselves as role model in society and advocates in health-seeking behaviors that are appropriate, but we need to be mindful what the context is. Again, let me make a few corrections. When we say that 40%, about 40% of health workers have not vaccinated, what we're actually saying is at least about 60% have vaccinated.
Right.
Actually, that is greater than the proportion vaccinated in our country.
Right.
I think Salome mentioned some of the current data that you can find on the Ghana Health Service platform, where we, for a whole population vaccination, we are now approaching 40%. We're not yet 40%. So in actual fact, health workers have actually done far better than the general population.
Right.
And that needs to be understood. But is 60% enough? I agree that that is not enough. We would be expecting that should be closer to full vaccination of every health worker.
Right.
More so because they stand a risk, even for themselves and their families, coming in contact with people who may not be symptomatic, but who may be infected.
Right.
So we are not just advocates, but we are at higher risk of infectious diseases than the general population. And for us, that is an extremely important reason why health workers need to vaccinate. It also means that we are actually an intermediary transmission point, because we are seeing different patients, including people who may be infected and who we are not aware that they are infected, bearing in mind that about 80% or more of people who are infected do not have symptoms.
Dr. Chris, once we're having this conversation, once you're helping us understand the figures and the numbers, I mean, if a critic says that the vaccinated and unvaccinated stand the same risks of both getting the virus and getting ill from the virus, what would you say as you try to educate people and try to convince as many people as are watching to go and get vaccinated? What would you say if the critic says, well, whether I'm vaccinated or not, I've seen people fall ill, I've seen people die who were vaccinated, so why should I take it?
Thank you. And again, I think that clear information is the best way of dealing with some of this. So without going into semantics and without lots of medical language, all of us stands the same risk, similar risk of being exposed, as long as we behave the same way, and I mean with respect to the preventive protocols. So if we all do not wear our mask, if we all do not follow hand hygiene protocols, if we are not giving distances to each other, we are not getting vaccinated. And now I actually add vaccination as one of the preventive protocols. We all stand the same risk of exposure.
Right.
When you're exposed, you stand the same risk of being infected.
Right.
Infected is not the same as disease.
Right.
Let's have that clarity first of all.
Right.
Exposure and infection are not the same as disease. That is why you have over 80% of people who may be infected, but who may not have severe disease. So what that means is that who is at higher risk of developing severe or critical disease in these two populations. And the data is extremely clear that for those who have vaccinated, that they stand far less chance of developing severe disease and dying from COVID-19 compared to those who have not vaccinated.
Right. Thank you for
and
that.
If that is,
please go ahead. Please finish the
yes, go
thought.
ahead.
Please finish the thought.
So if that is the situation, the clear answer is that yes, until a point in time, our vaccination level in itself interrupts a spread. And that will happen if we vaccinate to a very high proportion and maintain our immunity. But till that time, those who are vaccinated stands far less chance of severe disease and dying from COVID-19 than those who are not vaccinated. It does not mean that we will not have some people who are vaccinated who may not develop severe disease,
right.
But the proportions are significantly different.
Right.
And along the line, I will provide you some of those statistics which are local, not just from
We're curious in seeing those numbers, but hold the thought as we go to Dr. Alfred Kwesi Manye. I hope I got the name right, and then we'll come back to you. So we're curious in seeing the numbers. But doctor, please tell us, I mean, the argument is we've had COVID in a way that we did not see numbers as other countries. Have we managed it in a way that we can say that COVID is over? Are we at the place where we can say that vaccination is not, I mean, we are okay because we have been okay? Can we say that? If you can hear us, Dr. Alfred, we're happy to see your thought. Help us evolve our local dealing with the virus and where we stand currently with the virus. Dr. Alfred, please, can you hear us?
Thank you very much. Good evening to you and to our listeners. And can you hear me?
Yes, I can hear you. Please go ahead, sir.
Yes. I will not say that we are out of the wood yet. COVID is here, still here with us. So in simple terms, I would say COVID is not over, and all the safety protocols that we've been applying, wearing of nose masks, washing of our hands, using sanitizers, social distance, and all that, we still have to adhere to it strictly, in addition to the vaccines that are available, we are taking.
Right.
So you can't say that you've taken the vaccine, so you will not adhere to those protocols. They are very, very important. And I think this is the time rather that we have to adhere to those protocols more than ever.
Right.
So that is what I will say. That,
is COVID here to stay?
Here with us. We cannot stop adhering to the protocols.
Dr. Alfred, is COVID here to stay? Are we expected to live with COVID for reasonable time into the future?
For now, looking at what is happening, we just have to accept that COVID is here with us, and COVID, we have to accept it like one of those diseases that are staying with us.
Right.
And we have to live with it. The thing we have to know is that we've been able to use the protocol, adhering to it, and have been able to bring down the cases. And now we have vaccines around. So just adhering to those things is going to help us a lot. But the disease itself, for now, we just have to accept that it's here to stay with us.
Right. So everybody gets vaccinated, or people who say they will make an election to trust their natural immune system. You are a doctor. You are an epidemiologist. I hope I got that correct. I almost massacred that. You're a biostatistician and you're a research fellow. If people want to trust their natural immunity, what would you say to them? You know virus a little more. What would you say?
I think COVID vaccine is not the only vaccine that we've ever used in Ghana. We've been using vaccines over the years, and we know what vaccines can do. Anybody who takes a vaccine will be better off, although we know that the natural immune system can help. But what I will say is that taking a vaccine against some of these diseases, you will be better off than depending on your natural immunity. And like the numbers that have been mentioned, the percentage coverage of the vaccine that we have, if we are going at this percentage, we will not realize the full potential of the vaccine.
Right.
So the best thing to do is to be able to encourage people, be able to deal with some of the issues that is making people not to take up the vaccine, so that we'll be able to increase this coverage.
Right.
Otherwise, we will not realize the full potential of the vaccine. So, depending on the natural immunity, I will not advise that, since we now have vaccines that are efficacious. They've worked.
All right, let's go to Dr. Chris Owu to look at the local numbers. Dr. Chris, if you can hear us, you're the National Case Management Coordinator. Tell us, locally, you said there were some local data to tell us in terms of probability of getting diseased when you contract the virus. We're happy to hear those numbers, just to make a case for viewers watching to go and get vaccinated. So, Dr. Chris Owu, if you can hear us, we're happy to hear those numbers. Dr. Chris, can you hear us, sir?
Yes, I can.
Right.
Thank you very much. Can you hear me?
Yes, I can hear you. Please go ahead,
so,
sir.
Thank you once again. So, between the beginning of vaccination in Ghana and end of December last year, those of us in National Case Management, I coordinate severe and critical COVID-19. We looked at what the data was saying in our biggest center, which is currently the Ghana Infectious Disease Center, the new infectious disease center that was built on the Guy's Municipal Hospital complex. So what we did was we looked at who were coming to our OPD. So we have an OPD where those who have tested positive with COVID-19 and could come. Those who are mild or moderate will be seen by doctors and nurses,
right.
Be assessed, and then be given medication. And then we would tie them to care. So they would be linked to our doctors, and then they would be allowed to go home and do home care, and we would follow them up. And they would come back the following week, and then after, when they are negative or they are discharged, they will continue in our post-COVID clinic. However, those who are severe and critically ill, majority of them were referred through our national dashboard to the Ghana Infectious Disease Center to be hospitalized in our critical care areas.
We would appreciate, for the purpose of the conversation, when you say majority, for example, we would be happy to hear 50, 58%, 90%, just to give us perspective in terms of...
So when I say majority, I mean, so the dashboard I'm talking about is actually for severe and critical disease.
Right.
So that dashboard, there is a dashboard that exists in Greater Accra, where all the facilities, all the district municipalities are able, and they get a case that is severe. Through their district management, health management team, they are able to refer those cases onto our dashboard. That dashboard has the representation from all the centers, both public and private, in Greater Accra that does ICU or critical care for COVID-19. So it has Kolebu, Rich Hospital 37, it has Nyaho, Aima, and all the other ones. We actually have about between 13 to 16 facilities that can do severe and critical.
Right.
So they are referred to that dashboard.
Right.
Now, usually our admission in GIDC comes from that dashboard.
Right.
As we speak today, a number of cases have been referred on that dashboard. But that dashboard allows us to also place patients in places like Kolebu Rich Hospital, depending on the
severity of the cases,
what problem the patient has.
Right.
Now, but what I'm saying is this, that majority of those who are coming to our OPD, who are usually mild or moderate, where basically walk in, or you tested positive, you want to travel, you go and test and you're positive, you can't be referred to our OPD, but you're not going to be admitted because you're not severe or critical. Now, during that period of time, we had over 1,000 people, and this is a period that is actually less than a year, who had come to our OPD with COVID-19, mild or moderate COVID-19, and 39% of them were basically people who had vaccinated, either taken one shot or have just finished their second shot. 61% of them were unvaccinated.
So 39 was vaccinated, 61 was not vaccinated.
Unvaccinated.
Right.
Obviously, when you look at that, you will say, oh, okay, but there are more unvaccinated people in the population than vaccinated. So that really does not mean anything.
Right.
And yes, what that means to us is that both the vaccinated and the unvaccinated are equally exposed.
Right.
That was not a significant difference.
Right.
So what did we look at? Then we looked at those who were admitted to our severe and critical ICUs, who were being admitted. 95% of those who were admitted were unvaccinated.
Right.
So the severe and critical, 95% were unvaccinated. Only 5% of those who came to ICU were vaccinated, really spared of severe disease and critical disease. As we speak now, majority of patients that we're getting in our critical care area in this particular wave, again, are unvaccinated. There are few people who have been vaccinated, and this includes an 87-year-old woman who had multiple medical conditions that are discharged just at the end of last week. She spent only 6 days in our facility.
Right.
I have two patients who are in their 50s and 60s who have spent 18 days and 16 days respectively, who were unvaccinated, and we are still struggling to get them out.
Right.
So the clarity is there, and this is local data. This is not data that we are basically borrowing from somewhere else.
So, Dr. Chris, if the numbers are
those who are
if the numbers are these clear, why are people hesitating to take the numbers? Is it a lack of public education? Is the education not being clear enough? What is the problem?
So let me actually say another very interesting thing. Do you know that in January, February, we had the highest vaccination in our country? That coincided with the period when we had another wave, that was our 4th wave, and then there was the declaration of the months of vaccination. We're talking about, we have administered about a bit over 16 million vaccines since we started vaccinating. Over 5 million of that, about 5 million of that were administered just in those 2 months. When people realized that people were dying, then they were running to go get vaccinated. People were actually asking, where can I get this? Where can I get that? Why do we? So it is not just that people are hesitant. It is, again, also partly our behavior, our health-seeking behavior. And we need to take that into consideration, that we do not have 40% of doctors, nurses, pharmacists away. Why do I need a vaccine?
Right.
I mean, there are some vaccines we used to have 20 years ago that we don't take anymore because those
it's not relevant directly to healthcare.
Yes.
Right.
So those need to go into the education work of basically lots of medical terms. The numbers are clear.
The viewers, and then we're happy to hear the way forward with Dr. Richard Salome. If you can hear us, what is the Medical Association doing to educate viewers a lot more and the public a bit more in terms of uptake, and what is the plan going forward?
Well, I'm sure you in the media have probably had the most statements released on a single item by our association on COVID. So we have been doing quite a lot, but we admit, and as Dr. Woods mentioned, that there's a lot to be done, especially on ourselves as health workers and then the public. So what we are doing now is to collaborate with the Ghana Registered Nurses and Midwives Association. One, to train health workers themselves to be vaccine champions. We are going to train 20 per region, especially focusing on some of the regions like OT, Volta, and a few other pockets around the country where hesitancy is quite high and vaccine coverage and uptake is relatively low. To first do good risk communication and then use local languages that people understand, to speak to their concerns about vaccines, how they work, the worries people have about the efficacy, and then this issue about the reasons are varied, and
just give us your top. Give us your top 3 on the hesitancy list.
We are yet to do the proper research for me to be quantifying which one is top 3, but we know religion plays a very key role.
Religion.
We also know religion, the fears. We will seek to highlight these issues, be available, make available professionals to speak to some of the fears, the concerns that the public have, and even health workers have, and address some of these challenges that they may have. Those that have genuine concerns and may have specific reactions, then we direct them to the right authorities to be able to document some of the concerns that they have, to inform the safety issues that come with the vaccine. So these are some of the things we intend to do, and this is also one of the mediums that we are using to encourage the public that go for the vaccines. If we get the vaccines, we will all be safe, and then we will not have the severe forms of the disease, and then we'll be able to gradually get back to our normal life. As Dr. Wu said, something like smallpox, we are not too worried anymore about it because it's gone. Once in a while, we'll have a few pockets here and there, but because of the good work that the vaccination program did, it is gone. We may well get to that point once we all get vaccinated and also adhere to the protocols that we currently have.
All right, Dr. Richard, let's take your concluding words. If a viewer is watching, what would you tell them specifically on vaccination? If they haven't vaccinated, just talk to them right now. In just a minute, we would like to know your concluding words as the Assistant General Secretary of the Ghana Medical Association.
Yes, what I would say to any viewer listening to me is that COVID-19 is still with us. All it needs is one person with a disease not obeying the protocols, meeting other people who are also not obeying the protocols, and the disease can spread and get back to the high numbers that we used to have. Safe. I have taken mine, the 2 shots and a booster. Many of us on this panel may have taken ours as well, and we are healthy. It is safe, and please, if you haven't taken the vaccines, kindly go for the vaccines so that you can protect both yourself and the people around you so that we can all get back to normal lives, hopefully as soon as possible.
Right. Thank you so much, Dr. Richard Salome. Now we'll go to Dr. Alfred Kwesi-Menye. We're having the vaccines. Should anybody prefer one to the other? And then just wrap it up in your concluding words for us. Dr. Alfred, if you can hear us, yes. Yes.
I think all the vaccines that we have available in Ghana, they have been approved by WHO, and they are good and for us to take. That is why they are in Ghana. So any vaccine that is available in wherever you are staying, it's good for you to take. All the vaccines available, they are very good. What I want to add to what my colleagues have already said is we have very good strategy in rolling out most of these public health interventions. The problem here I am saying is how it's being implemented at the lower level, looking at the context-specific issues. If, for instance, if we are educating the population and then we are having radio adverts and all those things. At the lower level, are those information getting to them well? And my colleague already talked about looking at the context-specific issues that are contributing to the low uptake of the vaccine. We talked about T and then Volta region. So it means that we can use the same message or the same strategy to implement the vaccine in some of these areas. So research is very critical for us to know the factors that are contributing to the low uptake, and we tailor the message as such for people to be able to take the vaccine. So what I will advocate or encourage is for us knowing the reason for people refusing to take the vaccine, able to fight this disease together. Thank you very much.
Right, thank you so much, Dr. Alfred Kwesi-Menye. Thank you so much for joining us. Now we'll get to end with Dr. Chris O. Dr. Chris O, if you can hear us, is it not late in time, at least later the ones of specific regions? By now, should we not have had a research fully backed by data to be able to know this is the reason why these people are refusing, and to plan strategies around that. As you answer that, please wrap it up in your concluding thoughts for us.
Yes, so thank you very much. It's never late. It's better late than never, actually. Yes, it would have been better if this education and advocacy had been sustained. Unfortunately, whenever the wave goes down, everybody also relaxes, and that is by extension the fourth estate of our population, the media. And I want to start off by saying that the biggest platform for education and advocacy is that which is afforded us by the media. And I think that the media has that as a national responsibility, not only to do this when there is a spike in numbers or death, but also to sustain it in between. And it is important because we have all had this information. So Dr. Salome, with respect to what he referred to, is basically among health workers, because there is documentation or data that is being put together to be sent out about health workers, but not necessarily
the public in general,
the whole general population. We know what are important indicators to vaccine hesitancy or our health-seeking behaviors. That has been overflowed in our health system. There's more than enough publications about what the barriers in our health-seeking behavior. Those barriers have not disappeared because of COVID-19. They have actually become more significant because of COVID-19. And that includes barrier to access. And access is not just whether we have the vaccine, because we have the vaccine, but even movement to go get the vaccines. That includes the fears people have about side effects, even irrespective of what, if you haven't had COVID or been severe with COVID, when somebody tell you that they took the vaccine and they had chills and headache, you think you don't want to have. Right. I mean, you see that all the time when you have to give somebody an injection, that the person is so scared of injection, he will wish that the doctor says, no, I won't give you the injection. Right. Not because he doesn't think that the injection will help. So these are things that we already are quite aware in our health system. But then we need to make this education, this advocacy sustained in between waves. There will be another wave in 3 to 4 months' time if we do not vaccinate enough. And that is as clear as night and day. So right. I mean, I'm not trying to scare anybody. We have had 4 waves. We are in our 5th wave. The same is happening all over the world. Right. If we do not vaccinate enough, if we do not continue to not play the
what percentage, just to end, what percentage is enough?